is Dr. James Case. He is a board certified in general neurology, sleep medicine, and electrodiagnostic medicine, and clinical neurophysiology. That one I had to remember from my grad school classes and everything. But then you're also the medical director of Neurodiagnostic and Sleep Disorders Lab at UND St. Luke's in Sioux City then. So, and thank you so much again for having us here then. So,
my pleasure, Steve.
Perfect. So the first question I really wanted to ask you then today is, what role does sleep have in our overall health then?
Well, quality sleep is vital for a number of things: mental health, physical health, quality of life, as well as safety. And I would add, in children and teens, sleep also promotes growth and development. So the first sleep role for healthy brain function and emotional well-being: sleep enhances learning, problem-solving skills, creativity. If you're sleep deficient, you may have trouble making decisions or solving problems. People who are sleep deprived take longer to finish tasks. They show slower reaction times, and they make more mistakes. If you have children or teens who are sleep deficient, we all know as parents, they may be angry and impulsive, show mood swings, feel sad or depressed. They lack motivation. They can have problems paying attention, which affects school performance and grades. Mm-hmm. The second role for sleep is in physical health. If we have ongoing sleep deficiency, patients develop increased risk of heart disease, kidney disease, high blood pressure, diabetes, or stroke. Interesting findings about sleep deprivation is it seems to tie into obesity. Sleep maintains a healthy balance of two hormones. One makes you feel hungry, that's called ghrelin. The other one makes you feel full, that's called leptin. And it seems with insufficient sleep that your ghrelin goes up, your leptin goes down, and that makes you feel hungrier and make bad choices with food. Tied into that, sleep deficiency seems to result in higher blood sugars, which may increase your risk for diabetes. Third role of sleep is in daytime performance and safety. Sleep deficiency can hurt you over time, as we just talked about, but it can also hurt us in an instant, such as a car crash. Sleep deficiency impairs your driving ability as much or more than being drunk. We estimate that driver sleepiness is a factor in about 100,000 US accidents each year. And then after losing several nights of sleep, even just a few hours per night, your ability to function suffers as if you haven't slept all day. There's a phenomenon called microsleeps. Microsleeps are these brief moments where you may not even realize it, but you're asleep. I think that's happened to people who realize they've gone down the highway. It's been 30 seconds and they had no idea that they were still driving. Those kind of microsleeps have been important for not only personal accidents, small accidents, individual accidents, but also tragic accidents on a large scale, such as nuclear reactor meltdowns, the grounding of large ships, or aviation accidents.
Wow, yeah. And that's like a lot of really good information to share with it too. And I know especially kind of on my end, I've kind of noticed this too with some people is we're not really sure about like, am I getting enough sleep? How do I even know? And how can I even tell some of those things? So, how can someone really tell if they're getting enough sleep at night? Is it just kind of basically kind of hours of sleep, or how can someone really kind of tell if, they really are getting enough of that way then?
Well, I'll start by saying a common myth is that people think we can train ourselves to get by on little sleep with no negative effects, where in fact that's a myth. Your body knows how much sleep it needs, and that's also dependent on age. And many people don't realize that they're sleep deficient. They think they can function well, but their body's lying to them. So the amount of sleep you need each day changes remarkably over the course of your life. The American Academy of Sleep Medicine has worked with the American Academy of Pediatrics, and they mentioned that, for example, infants under a year need almost 16 hours of sleep, or they get that. By the time you're children about 5 years old, perhaps 10 to 13 hours a day. Teenagers, who are notoriously sleep deprived, really need 8 to 10 hours a day on average. Then by the time you're an adult over 18, the typical amount of sleep is 7 to 8 hours a day. If you routinely sleep less than needed, you build up what's called a sleep debt, just like overrunning your credit card. So, for example, if you lose 2 hours of sleep each night, uh, after a week, you're going to have a sleep debt of 14 hours. Besides the amount of sleep, sleeping when your body is ready to sleep is very important. We have a problem called circadian rhythm sleep disorders, which is common in people who do shift work or business travelers, emergency responders. In those individuals, their sleep may be out of synchronization with their body clock or out of sync with the light dark cycle, and that can lead to problems as well.
Yeah, I know that I noticed that one was something that was interesting too to me because in our community we do have some of those shift workers then too who do work some of those irregular hours then too, and trying to balance like family life and work life and some of that too could really kind of be really difficult to know that then too. So it's really interesting for you to point that out and knowing like, hey, how this sleep debt really does accumulate over time and can lead into some of those sleep issues with it then. Um,
Yeah.
so what are even, when you're discussing some of those things about how if you're not able to get enough sleep at night, it can kind of lead to some of those different conditions, sleep deprivation stuff. But what are some of the different sleep disorders that you guys usually see, and really how common are they then?
Sleep disorders are very common, and of course, they can range from annoying to quite serious. If you add up all of the various sleep disorders, we have almost 80, 80 different diagnoses that are in our diagnostic manuals. And about 70 million Americans suffer from some type of sleep disorder. Now, out of those 80, there's really about 4 that we mainly see in practice. These include insomnia, sleep apnea, restless leg syndrome, and narcolepsy. And I can talk about each of those in briefly.
Yeah, definitely would be great information to share then. Yeah.
So to begin with, insomnia. Insomnia is a sleep disorder in which a person has difficulty either initiating sleep, they can't fall asleep, or they have difficulty staying asleep. So people with insomnia typically, they may wake up often during the night, then have trouble going back to sleep, or they have trouble falling asleep in the first place. They perhaps wake up too early in the morning, then can't fall back asleep. Their sleep is perceived as non-restorative. Insomnia affects all of us at some time. Many of us have brief bouts of what we call acute insomnia that can occur with medication changes, illness, stress, but it's not chronic unless it persists. Now, if you have trouble with insomnia for more than 3 nights a week for more than 3 months, that's called chronic insomnia. And those, of course, are the folks who tend more to seek help. Sleep apnea is probably the biggest and most important issue that we see. It's a potentially serious disorder that occurs when a person's breathing is interrupted during sleep. People with untreated sleep apnea stop breathing repeatedly throughout the night, up to hundreds of times per night in some serious cases. There are 2 major types of sleep apnea, central and obstructive. The obstructive is the more common of the two. That's where the airway blocks, usually when the soft tissue in the back of the throat collapses during sleep. These are the patients that you will hear snoring, gasping for air while sleeping. They experience daytime sleepiness, fatigue. Their sleep is restless, and they have trouble concentrating during the daytime. Central sleep apnea is less common. That's where the airway is not blocked, but the brain just doesn't seem to be giving messages to the body to breathe. And there's various causes for that we also treat. Restless leg syndrome is common. It's a sleep disorder that causes an intense, almost irresistible urge to move the legs. It's worse when a person's trying to rest or if they're sitting quietly in a car or trying to watch TV. It makes it difficult to fall asleep and stay asleep. It can bother people, especially in the evening. And folks who have it will oftentimes get up, move around, shake their legs, trying to relieve that uncomfortable sensation. That can be due to medical troubles. It can also be seen with iron deficiency. Certain medications, even antidepressants of certain types, can aggravate that. So that's something that if you have restless legs, don't try to diagnose yourself. It's best to see your family physician or a sleep specialist. Narcolepsy is less common, but that is a neurologic disorder that falls into my territory. It's a disorder of sleep regulation coming from brain dysfunction. People with narcolepsy experience excessive daytime sleepiness. They can have intermittent, almost uncontrollable falling asleep episodes during the daytime. Some people with narcolepsy have an entity also called cataplexy, in which there's sudden muscle weakness provoked by laughter or emotion. That usually begins in teenage years up to young adulthood, say age 25. It can become apparent at later ages. Oftentimes, narcolepsy is undiagnosed, sometimes for years, and therefore untreated.
Interesting that way then, and I know you talked about this too with the sleep apnea, and this is kind of what brought it as an interest too. Is I had a family member who actually kind of went through some of the diagnostic process of how to get just to tell if they had sleep apnea and some of those complications. But kind of what's like the normal process that somebody goes through if they're going to be diagnosed for a sleep disorder then?
In the case of all sleep disorders in general, it's best to start with your family physician or other health professional, and they often can do a great deal from their general expertise. And then under certain cases, there's a referral needed to a sleep disorder specialist or to a sleep laboratory. In the case of sleep apnea, it's diagnosed by a test called a sleep apnea test or a polysomnogram. That can be done in some cases by a home test in which you simply hook up the device yourself, then return it. If you have a more complicated situation, you may still need to go to a sleep laboratory associated with a hospital, such as we have at UnityPoint. And there you're attended by a professional called a sleep technologist as they study your sleep for the night.
Okay. Yeah, and that I think it's always like a good option for people to kind of like know to look for that too, especially for how important sleep is. Like you talked about beforehand, is if they're having some of those difficulties when they're sleeping and they're having some of those complications, it's always really important just to bring it up right away to their general practitioner and general provider to really have those conversations about sleep and just knowing that they have some options going forward with that then too. But so I guess to really kind of see with it too, and knowing how important sleep is for us, then what are some tips and just general recommendations that you can provide for people for improving their quality of sleep then?
I think those tips are especially timely in this coronavirus pandemic because people are being thrown off their previous consistent schedules. That's even been given a name. There was a Washington Post article just the other day, and they call it Corona Somnia. I thought it was a cute article. So to get good sleep, you have to have good, consistent sleep habits. We call that sleep hygiene. So some sleep hygiene tips would be consistent. Try to go to bed at the same time each night and get up the same time each morning, and that includes weekends. Use the bedroom for sleep. It should be quiet, dark, relaxing, and at a comfortable temperature. Don't use the bedroom as your office and bring in your iPad or other electronic device. Really, ideally, don't watch TV, don't use computers or smartphones. Take those from the bedroom and use the bedroom for sleep. Also, those devices produce bright light that throws off your melatonin and your sleep cycle, almost as if the sun's rising while you're trying to sleep because of the light exposure. Be careful about large meals, excessive caffeine, or even alcohol close to your bedtime. Get some exercise, but exercise is best if it's in the early evening or afternoon or morning. A vigorous exercise just before bedtime can sometimes be arousing and disturb sleep as well. So in addition to those sleep tips, which I think apply to everyone, especially adults, teens should especially avoid screen time an hour before bed. They should ban these all-nighters where they put off studying and they do their homework at the last minute. And teens, it's helpful perhaps if they write in a diary or a to-do list, write it down, put it aside, and that way they don't lay there at night thinking of what they have to do the next morning. It's already taken care of. Then teens who tend to be night owls, they should try to sleep no more than 2 hours later on the weekend than on weekday mornings. Otherwise, they throw off their sleep cycle.
That's good information to have too, because you know, a lot of people tend to think that they can maybe just make it up on the weekends, their lack of sleep during the week too. But I was hoping you can kind of touch on that too, of like why that is really important. Kind of try and keep that as your normal schedule, like as it is during the week. Then.
I use an example with my patients. If you think back to the time when we were cave people, in a sense, the sun and the darkness were our time givers. They are what let us know what time it was. And so we didn't think, well, it's a weekend, so I can stay up late and run my electric lights. Or boy, there's a great Netflix movie on, so let's just go ahead and pound through some Netflix movies till 3 in the morning. You would get up as the sun rose and you would go to sleep as the sun set. And this had to do with the way that our bodies work for hundreds of thousands of years. Neurochemically, we're set up for that. And so many of our habits in modern society conspire to ruin our sleep.
Hmm. Yeah, yeah, that is really true too. Especially I've had that happen to us a couple times too before. My wife and I will stay up and binge watch some Netflix or do something else then too, and think, hey, we can just maybe sleep in on weekends then. But it's really good information to know. Like, hey, we try and keep that consistent schedule throughout the week, just so we really don't throw off some of our sleep rhythm that way too, and try and keep a good sound sleep hygiene then at least. Um, so for my last question, I really just wanted to ask you about, where can people go if they were looking for some additional information, some resources, or just some general kind of information on healthy sleeping and trying to keep a healthy sleep hygiene then?
For the most part, the internet, it has wonderful resources. So I think as long as you try to stick with reputable, uh, nationally recognized foundations, you'll find some excellent information out there. One of my favorites is the American Academy of Sleep Medicine, of which I'm a member. Uh, the National Healthy Sleep Awareness Project is another one. The National Sleep Foundation, the American Sleep Apnea Association. There's also the Narcolepsy Network. There indeed is a Restless Legs Foundation, uh, and a number of others. If you have interest in reading more about the impact of sleep loss as it affects public safety, there's resources such as the National Highway Traffic Safety Administration, OSHA, resources like that. But there's a lot of good resources out there, and I think your primary care physician would be a great place to start as well.
Oh, good. Yeah, that's really good information for people to be able to go look at too, if they're really kind of interested in hearing more about that information then too. So, well, thank you so much, Dr. Case. I really appreciate your time today too, and really sharing your expertise on sleep and our health benefits that way then too. Yeah, really just appreciate your time, and thank you again for being willing to share this then.
You bet. It's been a pleasure.
Yeah.